Everyone, welcome back to Heart to Heart. I'm Cindy,
And I'm Grace.
and today we're going to be talking about and also investigating a pretty exciting question. Can AI help researchers find treatments for rare diseases?
hmm Let's focus on Kawasaki disease. Kawasaki disease is an autoimmune condition and a rare disease. An autoimmune disease is a condition where the body's immune system mistakenly attacks its own healthy cells, tissues, and organs, causing chronic inflammation and damage. A rare disease, on the other hand, is a disease only affected by less than 200,000 people in the US. The legal definition of a rare disease varies internationally due to different population sizes.
Yeah, and right now, with the rise of AI and there's also different technology, since it's changing so much and there's so much debate between the pros and cons, but today we're going to be really exploring on how it's changing, potentially changing medical research in a pretty exciting way. And spoiler, it's helping scientists potentially discovering new treatment possibilities faster than before. And so we're going to be going into the story of Dr. Fajgenbaum and his nonprofit, as well as how he's doing and using AI and then also drug repurposing to bring new hope to people living with rare diseases like Katie.
Okay, so talking about Dr. Fajgenbaum, he was a UPenn medical student who nearly died 5 times due to Castleman disease, which is a rare autoimmune condition that affects the lymph nodes. And he turned his own illness and story into his own research mission. He found his own cure to his disease called sirolimus, and he wrote many scientific papers that added on to the scientific community. He created the Castleman Disease Collaborative Network in 2012, and that helped patients and doctors become advocates and researchers for the disease. He also wrote a book about chasing every cure and became a national best-selling author, which was about his journey and his research. And in 2023, he got the Philadelphia Citizen of the Year award, and in May 2025, he made it to the Time 100 health list. And he was really recognized for what he did for rare diseases.
So now that we have a little bit of context on what is going on, definitely want to go into how exactly is AI helping and its role in all of this. And so what we're getting at here is that AI isn't replacing doctors or researchers, but instead they're helping them analyze huge amounts of medical data a lot faster than humans can do on their own right now. And so one of the big ways it's going to help this process is something called drug repurposing, and also what Dr. Feigenbaum is his core mission is also based on around or his core method. And so what drug repurposing means is that it's taking a medication that's already approved for and that for one disease and seeing if it can be used to treat another. And so instead of treating and spending years and years developing a brand new drug, researchers can ask, and could a medicine we already have work for this disease? And so because these drugs have already been tested for safety, this approach can definitely save a lot of time and also money, and especially for different rare diseases like Kawasaki disease that often don't receive as much research funding. This can be incredibly helpful and also saving a lot of time for patients to actually get and try out after. So, what Dr. Feigenbaum is essentially realizing and doing is that he realized that there could be essentially medications that are sitting on different pharmacy shelves that might be able to help treat other diseases that we just haven't discovered these connections to yet. And so essentially what Every Cure is doing is that they're using AI to compare different existing drugs with thousands of different diseases and really helping researchers identify promising matches that deserve further study. And so they're filtering out the combinations for us already with their intelligence. And that's why we're able to prioritize the most promising different combinations. And right now, with Every Cure, they also discovered already 14 treatments that have been repurposed. And then also from 2024, Every Cure have also received $48.3 million in federal funding. And so that's why we're super excited to see what they can do with that and potentially help out with rare diseases and finding those combinations that can help treat these diseases like KD. And so this is especially important for KD, circling back to our main point, is because many don't have these approved treatments. So that's why traditional drug development can take so long. It can take over a decade and cost billions of dollars. And so it makes it very difficult to invest in diseases that affect fewer people. So these rare diseases. And that's why AI and drug repurposing can offer a really faster and more affordable way to search for different new treatment possibilities.
Thank you, Cindy, for talking about AI. I know AI is a very controversial topic right now, and I often hear about all the negative aspects of it, but it's great to hear how there are also some positive sides of it in the healthcare and science world. Now we're talking about drug repurposing for perhaps KD treatment, but why does that matter for us? First, Kawasaki disease mostly affects kids under 5. Toddlers that are under 5 who are affected by KD cannot advocate for themselves. So we need to advocate for faster treatment and different treatment options. Also, autoimmune and inflammatory conditions similar to KD, such as lupus, arthritis, and even the long-term cardiac effects from KD itself, often show up in teens and young adults and even adults sometimes. And that shows how relevant KD treatment is, and different treatments for autoimmune disease and rare diseases are important. So that's why we should care. Okay, finally, you don't have to have a medical degree to be part of the solution. Drug repurposing research runs on AI and data science, which screens thousands of existing drugs computationally instead of one by one, which helps find our treatments, and bioinformatics, which finds hidden connections between diseases. And most importantly, what we're doing here today, advocacy. We're pushing for funding and faster trial pathways. No matter the scale, whether big or small, of your advocacy is important and it means a lot.
And adding on to what Grace has already said amazingly already, so we really want to explore also what this really means for Kawasaki disease. And right now, there's no true cure for KD. And so that's why, even though AI hasn't really found anything yet, the tools that Every Cure is developing and then also using right now could potentially help these researchers and KD researchers identify existing medications that might be worth studying more in the future as well for Kawasaki disease. And then also more importantly, this also reminds us that innovation isn't always just creating new medicines, but it's also about finding smarter ways to use the ones we already have. And so that's why it's super great to see these technologies and these new methods being brought up and really being discovered for us to better society and also find these necessary cures for KD and other rare diseases. And so, definitely at the same time as well, technology alone isn't enough because obviously research moves forward because of patients and families and also doctors and advocates. And so, as Grace already said before, advocates that continue raising awareness and also supporting rare disease research is incredibly important. Then also organizations like KDF also play an important role in making sure diseases like KD aren't overlooked. And so we're really making sure that families have access to the resources and support that they need, and that's always important as well. And so we really want to hammer down that idea as well.
Thank you, Cindy. That'll be all for today's episode. If you guys are interested and want to learn more about Dr. Fajgenbaum, you guys can search him on the internet or read his book, Chasing My Cure. Thank you for watching and have a nice day.